I would also like to invite our international faculty, Dr. Esam El-Toki. Sir, please, can you come on stage? It's a pleasure to have Dr. Esam, who has traveled all the way from Egypt to enlighten us about his preferred practices in oculoplastics. He is currently the professor and heads the oculoplasty service at the Cairo University Hospitals. He conducts a very famous oculoplastic training course every year called A to Z of oculoplasty surgery in Egypt, and he is going to be speaking to us about baby Botox and techniques of Botox in aesthetic practice. Over to you, Dr. Esam.
Bismillah ar-Rahman ar-Rahim. Thank you so much. Thank you for the invitation. I'm greatly honored. My topic, and I'll try to convey with the timing, is about Botox. And Botox was a milestone in cosmetic surgery. It is the single most commonly performed cosmetic procedure all over the world. And everybody knows that plastic surgery was one thing before Botox and one thing after Botox, okay? And almost everybody who's doing a plastic procedure on any part of the body will always have Botox with it. But also, if you ask any patient or person who used Botox, what is the drawback of Botox? They will have only one answer, that it is not permanent, okay? Everybody wishes to have a permanent, lasting effect of his cosmetic procedure. How can we have a permanent Botox effect? Okay. Can we move the slides, please?
Can we have the slides running?
Okay. The classic Botox injections entails that the patient will come, have a full dose of the Botox, and then after a few months, when the wrinkles starts to come back again, he will come again to get the same dose of Botox. Time has taught us that even the patients who are persistent and who take their Botox injections regularly, the Botox will have a cumulative effect. And by time, the length between injections widens, and even the dose of the injection required to produce the same effect decreases. And this is because of remodeling of the tissues. When you change the tissue positions to the new wrinkle-less position and keep it there, it's more difficult, even with return of the muscle tone because of the skin remodeling and the subcutaneous tissue remodeling, to return to the same old effect with wrinkling. So we all know that Botox has a cumulative effect. With baby Botox, we give the first initial dose a full dose, okay? The same as the regular protocol of injecting Botox. But we ask the patients to come back after 6 weeks up to 8 weeks. Wrinkles have not gone back yet, but we will give him a baby dose of the Botox. We'll give him 25 to 30% of the initial dose. And by repeating this, we will actually keep the patient wrinkle-free all the time. And this is a simple graph comparing the red, which is the classic protocol of injecting Botox, where the wrinkles are high. You give the full dose of Botox, patient remains wrinkle-free for some time, the wrinkle starts to come back again, and when they come back, the patient comes for the next injection, and so on. With the baby Botox protocol, you give the initial dose, the patient, the wrinkles disappear, he's wrinkle-free, and before starting for the wrinkles to come back, he comes and gets a smaller or the baby dose. It's like vaccination and booster doses, okay? And this way, you are changing this up and down regimen into an almost flat regimen. This protocol has started with celebrities, with TV presenters, even with politicians who appear in public every day and who don't want to look good for a couple of months and then have wrinkles and then look good again for another, and so on. But what we have been doing in the last 2 or 3 years is that this is becoming the standard of injecting Botox. And we are actually achieving several advantages. Generally speaking, we're using less amount of Botox. So we definitely have less amount of complication, less incidence of complication. And actually with the small baby doses, we don't see any more doses occurring after Botox or lower lid weakness or dryness, because for every injection, the dose is about quarter of the initial injection. The second advantage actually is that the cost is reduced over time. Not only this, but even the bulk of the dose of the cost has moved from being the cost of the material going to pharmaceutical companies to the cost of the injections going to the surgeon. So it has a major financial advantage for people who are injecting. Even if patients are paying the same, but this amount is mostly directed to the surgeon rather than to pharmaceutical companies. Actually, the third advantage is that remodeling is more pronounced and more evidence with this small doses. You are not allowing the tissues and the muscles to ever return to the wrinkle period. They will always be in a wrinkleless shape. So you are making it much easier and much faster for remodeling to occur. And as I said, it eliminates definitely any possibility of frozen look or ptosis or ectropia. Thank you so much.
A very beautiful presentation. I think this is really a very nice technique, as mentioned by you. It's very good, especially who are in the acting profession, especially the celebrities, and also for the politician who needs to also want some other expression. Beautiful presentation.